Hello, everybody, and welcome to episode 39 of the On Air Advocate. And this is a special edition today. At the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who do not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And we are super excited that you are joining us. If you're in Arizona, morning time. If you're in Wisconsin, afternoon time for this broadcast live, or if you're catching it on the replay. Now, most of you know we kind of structure all of our weeks by different focuses. And last month in April, we had a whole month-long focus on Autism Acceptance and Awareness Month. And so at that point, I was introduced to Dr. Grise, and I really wanted her to be able to share with you guys, but we couldn't make it work in April. So she is here today for this special edition to share with us. Dr. Grise is a neuropathic physician in Arizona. And so today she's going to be discussing with us some different diet, supplementations, and homeopathic approaches to treatment for those on the autism spectrum. So welcome.
Thank you. I'm happy to be here. Thanks for having me.
Oh, thank you for being here. So before we kind of dive into that, a little bit maybe about the background, like how did you get into it's naturopathic medicine, right?
Yes.
Is that
that's correct.
Homeopathic, do you use both terms, or are they kind of like slashed? Like homeopathic, naturopathic?
It's interesting. I'm glad you asked, because it's a misconception. A lot of people think that they're synonyms, they're one and the same. But naturopathic doctors who are have gone through a 4-year medical program.
Okay.
We are trained in many different modalities, including herbal medicine, acupuncture, homeopathy, and we're also trained in prescription medications as well. And so homeopathy is one of the modalities that we use as naturopathic physicians. And then there's a different differentiation between naturopathic doctor and naturopath, which, some practitioners will get, there's online certification programs and things like that, which, teach some of these concepts and some of the modalities, but without having a 4-year medical program. And so it's an important differentiation, but yes, homeopathy is one of the aspects that we use as naturopaths.
Okay, so homeopathy, you could go to get a separate certification just in that area or take a class in the area, but it's one of the modalities that's kind of added to your degree umbrella. In your 4-year degree. And I've learned all about that from some of the other students and whatnot that go to, because there's a college in Arizona, correct? That's one of the largest ones.
Yes, it is. It's here in Tempe, Arizona, and I'm lucky enough to be on the adjunct faculty there. So I've continued to teach there since I graduated in 2013. And there are about 5 schools now in the United States that are a 4-year nationally accredited institutions. And one of them is here in sunny Arizona. So that's why one of the reasons I chose to come to SCNM. But there are other colleges on the East and West Coast as well.
Wonderful, wonderful. So with all of your knowledge and the schooling in this area, I'm excited to hear some of your takes and things that you have found in the dietary needs, supplements, all of that when we think about kiddos that may be on the spectrum. But I was thinking about it before the show, thinking I bet a lot of the content that you also have to give could be good really for anyone in a lot of different ways. Or there are things that are specific. I'm sure there's some things that are specific, but I think that overall general health is, across the board taking care of, and taking care of yourself. But, kind of starting with that diet, what are your thoughts on that? So we can start from there.
Okay, sounds good. So, the biggest thing, there's been lots of research in this area. And so one of the big areas that we look at is considerations of food sensitivities and food intolerances. And so Things like gluten-free or dairy-free diets are often recommended. There was a study that came out a few years back that, a double-blind placebo-controlled study where they looked at gluten-free, dairy-free diets in comparison to other forms of diets. And they found that statistically, they didn't see a statistical difference in the behavior and symptoms of children with autism who follow that diet. But clinically, we see it all the time. And so I think what is important and what was missing in that diet is, of course, the gluten and dairy can be, and not for everyone, that you'll have sensitivity to it. But the more important aspects are things like sugar and food additives and food colors, these nervous system agitating molecules that are really important to remove, to prevent things like Alzheimer's and things of that sort, where we know that we can improve symptoms with, studies have shown with schizophrenia and with Alzheimer's disease that removing gluten dramatically changes their symptoms. And so I think that, as we continue to do more research, what I would like to see is including not just removing gluten and dairy, but also looking at these other kinds of stimulating molecules that often cause significant impairment and contribute to the disease.
Now, aside, what would you say, do you have kind of a list of maybe 10 different additives or items that way in diet that you would tell individuals that have children that are on the autism spectrum, or just in general, that are good things, like when you're having some complications, and obviously, other than the Autism Awareness Month from last month, this month we're focusing on pain management and chronic pain. So some of those things go equally together with our food modifications and all that, and inflammatory foods, that don't help in that area. But is there kind of like your top 10, maybe in your book, that if somebody's trying to rule things out, help things with their kiddos, that they could say, start with eliminating these one at a time, track it? What would you say those things might be?
Yeah, so, and you're so right. Inflammation alone, that is the underlying cause and contributing factor to so many chronic disease. So heart disease, chronic pain disorders, arthritis, things like that, dramatically improve when you get the inflammation down. So this is definitely applicable to many different conditions. So in naturopathic medicine, we do this thing called an elimination diet, and there's 6 of the most common food sensitivities that we kind of start with. And so what we would do is have somebody remove these foods, all of these foods, for a good 6 weeks or so, and then one at a time. And so that gives the body a little bit of time to kind of reset, recalibrate. And then after that 6-week period, you reintroduce one food at a time, week by week, and you just see what happens. And so those foods that we often avoid, we've got gluten, dairy, soy, corn, wheat, and eggs. So gluten and wheat, gluten is in wheat, but gluten is also in many other things. And so that's why we include both of those categories. And then of course I would add on to that, processed sugars, certainly sodas and things like that. And often we'll encourage people to, if they're going gluten-free and wheat-free, they're naturally going to decrease their carbohydrate intake. So just focusing on things like quinoa and brown rice and things like that, that are just, they're carbohydrates, but they're much less inflammatory. But there's also, each individual is going to have different things that they're sensitive to. And so if the elimination diet, if somebody were to do the elimination diet and they reintroduce the foods and didn't notice a change in their skin or their mood or their emotions, things like that, their cognition, then it may be something else that you wouldn't expect. And so doing a blood test to look at, it measures the IgG levels in the blood to see how your individual immune system is reacting to the proteins of various different foods. And depending on the company, they test anywhere from 80 or so foods up to over 150 foods. And so, and including spices and things like that. And I have, the test is anywhere from $150 to over $300, depending on how comprehensive of a panel we do. But I have had patients that had things like lemon or mustard come up where we would have never guessed that, you know?
Right.
And so even healthy foods the immune system can become sensitive to them. And even though they're healthy for your immune system, it doesn't work well. And so doing that blood test can help us identify other things that we wouldn't have expected.
Okay. Okay. And I think maybe after this, when we're kind of wrapping up, maybe we could take those foods and list them out, and then I can drop them below just for people to cross-reference back to some of those things to start with. Now, how do you feel that, we work on our diet and eliminating those things, you track it with your kiddos to see if you see any behavioral changes or feeling changes, if it is any other type of illness, that it may be. But then what about supplements? Adding supplementation, because I hear a lot of times that can be a very fine line of like taking too much of things, and sometimes people don't need things and everyone thinks they need to go to the store and just buy more vitamins and get more things, and a lot of times your body doesn't need that. What is your take on that?
Yeah, so, depending on the intensity of a patient's symptoms, and especially, if they have a lot of digestive symptoms like, bowel issues or gas and bloating, things like that. And also depending on the number of foods that come up, if we do a blood panel, if we see more than 15 foods that the immune system has marked as foreign and creates an inflammatory immune response to, then we know that the integrity of the intestinal lining has been compromised, because there's way too many foods that are the immune system's reacting to. So in that case, we would likely do some supplementation during that 6-week avoidant period. That way it can help work on healing up the gap junctions that are between the cells and the intestinal lining, and do some, and adding in probiotics and things like that to help heal up the gut and reduce the inflammatory response, so that then when we get past that 6-week point and we begin the reintroduction, we often have a much higher positive response with that, because we've done the work to heal up the intestine. And so there's some products that we use often, but with autism spectrum, we have to take special consideration. I mean, in many different areas, because of the sensitivity, the entire system is just hyper alert in a lot of ways. And so some products that we often use with patients are things like glutamine, which can move on to glutamate, which glutamate is an amino acid that is really stimulating. And so for somebody who has who's on autism spectrum, just they may not tolerate the glutamine powder well, whereas somebody who doesn't have that kind of sensitivity to a more excitatory state, they would have no issues with it. And so we would just have to consider that and likely choose a different approach to that for our patients that are more sensitive. And so sticking with things like probiotics and other sorts of herbs that are really soothing to the intestinal lining. So we call these demulcent herbs, things like aloe and slippery elm and licorice, deglycerinated licorice. So these are all things that will help build up the mucus layer. We have a mucus layer all the way moving through our digestive tract, and sometimes that's part of what wears down and allows for these molecules to leave and get the immune response. And so we would just, depending on the case, supplement and heal up that lining and replace the probiotics as well.
Okay. And so that's kind of talking about all the tummy issues that can happen. What about things like when we hear maybe we want to try adding more vitamin C or vitamin D or those types of things? Is there specific on that panel of testing you were talking about? Is it going to show deficiencies in that area? If there's lack of, or does that test only test for, just certain things? I know low iron, that a lot of times is an issue, and things that when people trigger, I'm going to add a supplement on, a lot of times the first thing they think, I'm going to add a probiotic, or I'm going to add a vitamin C, or I'm going to go get, the D3, or, all of those things. So what other ones would you say are effective or helpful at all for people that are kids that are on the autism spectrum, or just in general? And is there any type of specific testing for all of those, or is that in the one test that you mentioned? It tests all vitamins and minerals and things like that in your body.
So the food allergy test is just specific. So that's going to look at the IgE, which is the immediate response,
Mm-hmm.
and then the IgG, which is the delayed immune response of specific foods. But there are blood tests that we can do. I use a company called SpectraCell quite a bit. They have a micronutrient panel which measures things like magnesium and the B vitamins, and even things like inositol, which is an inhibitory amino acid. It's a calming amino acid. And so that is one of the things that I have seen come up with patients who have more of a hyper alert system, whether it be from Alzheimer's or schizophrenia or autism spectrum. So we can measure and look at the vitamin levels and the antioxidant levels as well. And so that's called the SpectraCell micronutrient panel. And then, of course, with blood tests, we would just measure, get a serum vitamin D, 25-OH vitamin D, the active form of the vitamin D. And then, depending on their symptoms, if they have signs of anemia from a basic blood count, then we could just measure the iron and the B vitamins, the B12 and folate in the serum. So those would just be additional tests that we would need to order as a blood test separately.
Okay. And is that something that your regular MD physician would be doing, or is that something more if you were going to see a naturopathic physician would be doing?
Well, I would hope that all doctors would do those basic,
Okay.
The CBC and looking at the iron and the B vitamins, vitamin D. Now the SpectraCell micronutrient panel and the immuno labs or the lab, there's many other companies that do the food allergy testing.
Mm-hmm.
There's more and more medical doctors doing these tests. But as far as if insurance will cover it, things like that, very unlikely. And so that is one of the challenges with it, is that they're a bit more costly of tests compared to just a basic blood panel. And it's unlikely that it will be covered by insurance. But I have had some patients that go through immunolabs, which is food allergy testing. They can get a super bill from the company and get reimbursed by their insurance. So it's just depending on the plan. And so it is happening more and more. I think the whole country is realizing that there's so much more to medicine than just, you don't want to just avoid disease. You want to be well and thrive. And so there's so much more to health and well-being than just not having a condition. And so there's more and more doctors that are looking into these, more comprehensive and preventative kind of panels. So hopefully over the next 5 to 10 years, we'll have these all covered by insurance, and naturopaths will be covered by insurance. But we're certainly moving in that direction. So.
Right. But at least we're moving in the right direction, right? That's the main thing. Now, I know that you had mentioned within that diet and supplementation, supplements and whatnot, fish oils. Can you tell me a little bit about fish oils? I don't take any fish oils, but I'd love to know more.
Okay, certainly. And so omega-3 fatty acid, they are so helpful for many different conditions because they modulate inflammation, and which is why they're recommended for heart disease, for diabetes, for cognitive disorders. And, if we think about the low-fat diet craze that created this epidemic of so many different chronic illnesses, we shifted from eating a lot of fats to eating a lot of carbohydrates. And all of our cells, they have a lipid bilayer around them. So every cell in our body has fat, and our brain and our nervous system is full of fat molecules that allow for the nerve conduction to take place. And so it is really the reason that we encourage getting good, healthy fats in at a pretty high level is because it improves the nervous system, and it improves the way that the cells function all across the body. And so the omega-3 fatty acids are more anti-inflammatory. The omega-6 fatty acids are the more pro-inflammatory, or arachidonic acid is the most common omega-6 fatty acid. And there are blood tests to measure these omega levels, omega-3, 6, and 9. And so you could find out if this, which way you need to go. But in general, eating a diet that's really high in conventional meats. So these would be non-organic, grass-fed meats. The cows, the way that they are, and pigs, the way that they're housed, it creates, and the food that they eat, their tissue just has a much higher omega-6 to omega-3 ratio. And so if you're eating that meat, then you're likely increasing that ratio for yourself. So what we will do is try to encourage our patients to stay away from those conventional meats and switch to trying to incorporate more freshwater fish as one of the highest ways to get the omega-3s in. And so, avoiding farmed fish and getting the wild caught fish that has a much, much higher ratio of those omega-3s. And salmon, those fattier fishes, have even high levels of the omega-3s. And then, of course, doing grass-fed chicken when possible, and beef and things like that, so that you can improve the omega-3 and reduce the omega-6.
That's amazing, that whole list that you just gave. Now, my question is off of the topic a tiny bit, but still on the topic. Obviously, there was the craze in, doing no fats, but then there was also the craze in doing, like with the Atkins diet, and doing all the fats and no carbs. So my question is all those meats and things that we referred to, if they are not, healthily fed animals and in a good, more, I guess you'd say, is it an organic environment? I don't know if I'm using the right terminology, for that. Is those fats really not that good for you? You know what I'm saying? Like, and which diet, because I think that's where there's so much confusion that comes in, is people are told be fat free, low calorie. Then you're told on the other side that you want to be doing high fats, low carbs. What is your take on that? Is it more that we have to look at the fats for really what they are, from the animals that they come from? And how does somebody know, if you're going to buy a steak, is there labels, or is there things that say, buy me, I'm healthier?
Yeah. Okay. Certainly. Yeah. So, the biggest thing that I think of is just the quality, right? The quality of your food is the quality of the fats, right? So foods that are fried, deep fried, they have fat in them as well. Right. But the trans fatty acid, the form of the fat, is the way that the body utilizes it creates more issues. And so we want to have much better quality fats. And so, you could certainly take a supplemental fish oil or something like that, or just work on eating more nuts and seeds, eating things like avocado, and getting more freshwater fish in your diet. And, with kids, it can be tricky as far as how much fish they're willing to eat. It really depends on their taste. But there's ways to incorporate things like avocado in smoothies. It works great in smoothies. And so I always just encourage parents to just keep trying. And even if the kiddo didn't enjoy it the first time, try it in a different dish, try it in a different way. And just, certainly if it's very clear that they're not going to take to it, then there are so many other really healthy food sources of fats that you can keep trying and experimenting with. So, as far as the meats go, you can, of course, finding a brand that is organic or grass-fed, and it will say on the label. And then, when you're at the fish counter, they say if it's farmed fish, if it's Atlantic salmon versus Pacific, if it's wild caught, things like that. And so you're just wanting to look out for the wild caught fish and the free range grass-fed meats when possible. And yes, it does cost a little bit more. And so what I always encourage patients to do is modify. How often are you eating meat, and how can you kind of balance out the cost of buying better quality by reducing how frequently you're eating it. And then that often it results in them eating more plant matter and more vegetables and beans, and just diversifying their diet a lot. And I think it's important, I started out talking about all the things you should avoid. But what I like to do when talking with patients is really emphasize everything that you should include, because there are so many more things that you can eat than what you can't eat. But when you're so used to eating a certain way, it certainly takes quite a bit of getting used to, and you got to refigure out recipes and things like that. But it really is the more fruits and vegetables, the more plant matter, the more diversity of color that you can incorporate in your diet, the better off you are. And so even if you have, the occasional pizza or, Wendy's drive-through or something, if 80% of the time your home cooked meals, you're getting in those fruits and vegetables in, and getting in healthy fats and using good quality cooking oil, that's another big area that we could discuss as far as the form of the oil that you're wanting to use. So I think you can't expect to be 100% of the time, all the time, but I like the 80-20 rule. 80% just really hone in on it, try and be focused, during the week time, and then have Friday night pizza and enjoy it, but if you have that Friday night pizza and Saturday and Sunday you feel significantly worse, then maybe it's not worth it, and so it's really just listening to your body and really paying attention to what's going on and how your body responds to different things. And that could be skin rashes or headaches, or having a runny nose is a really, sinus problems are really common with dairy. And so it could be any sort of symptom that you notice after eating that food, that's just a sign that you should probably avoid it. So.
Okay. And is there any site for parents that do have kids that are on the spectrum that want to be more creative, want to start to test out those foods, want to get some other cooking ideas, like you were talking about putting avocado into a smoothie? Is there any site that you like a lot, like a cooking site or a cookbook site or a cookbook just in general, that you found has, a lot of books we buy, there's like 10% that you love in it and the 90% you don't, like one that you found that like 50 or 60% of it is really good content, really good recipes, really good things to try, whether it's drink wise or food wise?
Well, there's a couple of books that I often recommend to patients, but there are aspects of, as you said, there's always going to be parts of it that you don't fully agree with. But the one that I would just start off with, it proposes the idea of a nutritarian diet, which just means nutrient density of food, right?
Okay.
How many antioxidants do you get from a cup of berries compared to a cup of rice? Significantly more the more fresh fruit and plant matter that we consume. So the book is called Eat to Live, and it's by Dr. Joel Fuhrman, and you can get it online. They also have a cookbook along with it, but he has so many references in there, looking at the research and showing how the nutrient level of various foods. But he is a very big proponent of a very low carb and even low fat diet. So he doesn't emphasize or recommend using oils to cook with and things like that. So from my perspective, and I deal with a lot of mental emotional disorders in my private practice, fats are so important for the brain and for cognition that I notice a lot of people that had been on a lower fat diet notice a huge difference, even if they just start incorporating eggs into their diet or butter, using butter or good quality oils to cook with. And because all of our hormones come from cholesterol, we need fat to function properly. And so his book is really good, and it really just helps you understand why you need to have so many fruits and vegetables in your diet. And that should, I really do believe that should be a very big proportion, the greatest proportion of your diet on a daily basis. And then getting in the good fats, though, that is something that he doesn't agree with, but that I definitely do. So I like to, you have to pick and choose.
Right. Now, what about the oil? Would there be a number one cooking oil that you would say is the healthiest? And that is, safe and good for kids as well as adults, that doesn't have some of those top allergens in it. My son is anaphylactic to a ton of things, which eliminates a lot of things from your diet, so I'm just wondering, oil wise, what you would say that way, number one.
Okay, so the biggest things that I would look out for, you wanting to find a cold pressed and unrefined or oil. So a lot of the oils will say expeller pressed, which just means, I mean, mechanically a machine literally to press the seeds or to
Oh,
press it. So the cold press unrefined makes it just a lot less chemical, that would move into the oil or be extracted, and then you're consuming it yourself. So that's the two things you're looking for on the label. There are many different kinds: coconut oil, avocado oil. They have different heat points, and so it really depends on what you're cooking. And so you'll want to be mindful if you're, a high heat point versus a medium heat point. You're wanting to make sure you're using the right oil heat point for what you're cooking, because if you're heating up something with a lower heat point, then it creates molecules that are unhealthy. And so that, often you'll likely have a few different kinds of oils in your kitchen, depending on what you cook. And then the other thing is that I use most often is ghee, organic ghee. And so it's clarified butter. And so, yes, it does come from dairy, but it has all the proteins removed from it. So it is a much more pure, and most people who, even if they're sensitive to dairy, will not be reactive to ghee. Okay. But of course, that would depend on the person. And so if they consumed it and they didn't do well on it, then definitely avoid it. But that's one of the many people that have a dairy allergy. Butter will cause some issues, but ghee won't. So and it tastes great, and it has really, really good flavor. So,
okay.
But
and is that something you would find more of your natural store, like a natural food store, versus your supermarkets?
The ghee, probably yes. But even places like Walmart and Kroger's, Fry's, different kinds of larger grocery stores often have a more natural section, or even within the cooking oils, you can find things like coconut oil and maybe not the avocado oil, but I actually get both of those at Costco. And so you can get a nice big bottle. They have my avocado oil I use is cold pressed, unrefined, and in a giant bottle that'll last me for a long time. Okay. So and a lot of these places, even I know in the Midwest, it's not Costco, but
we have Costco now. People are loving it here.
Oh, perfect. Okay, very good. And Costco is a great resource as well for organic fruits and vegetables and grass-fed meat. And I was just there last weekend and got a 3-pack of grass-fed hamburger that comes in 1-pound sections. And so keep one in the fridge, freeze the other 2, and just, thaw it out as you go. And so then you're paying, I believe it was maybe $20 or so for the whole thing versus, if you buy 1 pound at a time, it's significantly more for the ratio. So buying in bulk really makes it much more affordable for people. And then buying big bags of the greens for smoothies and things like that makes it more convenient.
That's wonderful, and a big shout out to the Costco.
I know Costco is great, and they're one of the biggest retailers of organic. So it's fantastic. It's win-win. We get better food for a nice price. So
wonderful. Now, I know we were going to talk a little bit about some homeopathic approaches and treatment for kids that are on the autism spectrum. So, I know that you were talking about that the homeopathy is really another type of modality. So, in explanation of what homeopathy all is and how can that benefit through what types of treatment?
Okay, certainly. So homeopathic medicine is a system of medicine that was created over 200 years ago, and it's a way to use very, very dilute substances to stimulate a healing reaction in a person. So homeopathy literally means like cures like. So it's the same disease, homeopathy, which is the exact opposite of allopathy, opposite disease. So in conventional medicine, you have depression and you're given an antidepressant. What often happens when you remove that drug is that the depression often exacerbates, gets even worse. Same thing with anxiety, with Xanax. We know that it causes this rebound effect where the body almost overcorrects and it makes it even worse. So what we use with homeopathic medicine, we, instead of giving something opposite the disease, we're going to use something that is stimulating their system in the same way that they're kind of leaning off kilter. So I'll give you an example. If a patient came in with ADHD, they're likely talking, 1,000 miles an hour. They're really restless. They're moving around really quickly. They're really creative, lots of ideas, likely trouble sleeping at night from just feeling really sped up all the time. And they look like they drank a pot of coffee, but they probably didn't. So we may, if that symptom picture fits, as if they're, consume too much coffee, and so they're leaning off kilter this way with these hyperactive kind of symptoms, we could give them homeopathic coffee cruda, which kind of pushes their immune system, their vital force in the direction they're already leaning, in order for their organism to push back and recalibrate. So it's almost like a vaccination. You give a very small amount of a disease or of a bacteria, and it creates the immune system to respond to it. And so often I'll describe it as like holding a mirror up to your system. You would have no idea you had something on your face till you looked in the mirror. And the immune system, the vital force, which is that innate ability to heal, what makes us different than a car that you back into a dumpster and it won't heal, the bumper just stays dented. If we cut our arm, it heals. So there's this natural healing mechanism that we all have, plants and animals have too, that sets us apart from inanimate objects. And so we're utilizing that. We're just stimulating that vital force to self-correct. And so for conditions such as autism, various symptoms that we associate with the disorder, but each individual has their own symptoms. Some of them have more of, eye contact is even more difficult, or the speech, or it's, different aspects, or maybe they have a lot of digestive symptoms. Maybe they also have a lot of skin symptoms as well, or, palpitations, things like that, where we would take the individual's case and find something in nature that fits as if they're toxic with that substance. So using plants and minerals and things like that. And so we would match their case with a homeopathic medicine and work with them to stimulate that self-healing.
Okay, and so is the medicine that they're being matched with some type of like a mineral or vitamin type of like a mixture, like a concoction kind of together that's going to press against it? It's something that they orally would take, or is it something that they would put on their skin as more of like a topical?
Okay, so they make all sorts of different kinds of homeopathic preparations, but what we do in classical homeopathy, it would be one single substance, and it would be taken, those little white sugar pellets. So you may have seen the little blue vials of things like Arnica is a really common used for aches and bruises and things like that. So you would just take 2 pellets of the homeopathic remedy, and anywhere from once a day to once a month, even depending on how long your system reacts to it. So I have patients that, their symptoms start to creep back in day 25, day 26, and it's the sign that their body has started to fall back off kilter and it needs another stimulus to rebalance itself back to, finding that equilibrium.
I just think this is so fascinating. And, I was talking with you before the show, so much of the point of the show is to explore different options. And I think when we have, we're parents of special needs kiddos and they have all different types of needs and you're trying to figure out what's a good match for them. It's a wonderful thing to be able to explore and to know what are other options out there to try. If you've tried some conventional options and those haven't worked, that there is something like homeopathy out there that, you can go in and meet with someone and be able to possibly have something that might be life-changing.
Certainly. It's so safe and so gentle. And, it's interesting. Research, in Europe, homeopathy is used all over. India, it's one of the most common modalities used. Here in the States, it just hasn't taken as strong of a hold. But recently, there's been some research using Arnica for post-surgery and to look at surgical recovery. And this significantly improved outcomes by giving somebody Arnica even prior to the surgery and then afterward as far as wound healing. And so these surgeons are seeing the positive effects of it. And so it's one of those things where if we can reduce the number of pain medications and things like that, then it's certainly worth utilizing. And homeopathy, because of how there's so many substances in nature that it can be used to treat all sorts of conditions. So any sort of symptom can be utilized or corrected with homeopathic treatment. It takes time, but it is a much more sustainable improvement to where you eventually will not even need the remedy anymore, and your body just stays in balance.
Okay, and if there are parents or adults that are listening that are like, I'm very interested in this, I want to learn more. I want to know, if there is somebody also in my area, but people who are accredited, because I think that's an important piece of the puzzle too, is knowing the difference between if you're actually seeing an accredited naturopathic physician versus someone who just got a certificate. Where can they go? Obviously, they could reach out to you because we're going to drop your website below, if they had questions and whatnot, if they don't live in Arizona. But where could they go to find out if a naturopathic doctor was actually a physician, accredited? Is there some kind of like a hub, kind of like the Better Business Bureau of all natural medicine?
Certainly, you can look at, so the American Association of Naturopathic Physicians, the AANP, so they are kind of the umbrella for the U.S. And so you can certainly check on there as far as, looking at the accredited schools and finding accredited physicians. And then certainly, within that, with telemedicine nowadays, we have an interesting opportunity to where even if somebody isn't local, we have the capacity to work with them. Now, often we would need them to come and establish care in person, and that initial visit, do a physical exam and all of that. But then you can be monitored and treated depending on the state. Though there are some states where naturopathic medicine is illegal, actually, and so it's not only practicing without a license, but it's practicing illegally. So but if most of the states here, if you establish care in person, then you can maintain that relationship via phone and via, like we're doing here today.
Yeah, like a Zoom webinar, whatever.
Yeah, exactly.
Online.
Yeah, and there's programs that are HIPAA compliant, so that the transaction it's all secure. It's encrypted in and out, so that patient confidentiality is maintained even through the webcam. So there's many options. Yeah, and there's a couple of doctors here in Arizona, several naturopaths that specialize in homeopathic medicine, because that's the other thing, of course, many different practitioners will utilize homeopathy, but if this is going to be the main modality or the main route in which you're wanting to get treated, because there are thousands of different remedies out there, it can be really hard to find the right remedy. And so even if patients had tried homeopathy before and didn't get good results, it doesn't mean that they couldn't get good results with the right homeopathic medicine. And so finding a practitioner that really specializes in this modality will likely improve your outcomes. It doesn't mean that any doctor couldn't eventually get to the right remedy, but it's so specific that if it's not the exact right fit, nothing happens, which is better than a pharmaceutical that causes other side effects. But at the same time, it can be quite a process of a lot of trial and error, where if it's not the right remedy, you're going to have to change and try maybe 3 or 4 different remedies before a noticeable change is obtained. And so, you'll just have to be mindful of that and understand that it's going to be a process. It's likely, monthly to every 6-week follow-ups. And then as this condition stabilizes, then it's often pushed out to every, couple months or so.
Okay. And I would definitely just reminding everybody that as they're trying those different things, they need to be tracking, because the only way we really know, it's not like, oh, I kind of feel like this good today and tomorrow, and then you don't remember what happened 4 days ago. And then you can't really pinpoint if it's the medication, if it's something different, if it's lack of sleep, whatever it may be, so that they're journaling and tracking well.
Right. And looking over a long term, and that's such a good point, the day by day, we all have off days, and so, but the overall trajectory, we should see a steady improvement upward. And often with homeopathy, 2 steps forward, 1 step back, as the system gets stimulated and some symptoms improve and then other symptoms get worse. And we might have to change the remedy as the individual changes. And then the other part of it is that because it's so dilute, it's almost like I don't like to use the term energetic medicine, because it causes such a significant impact, but it is such a dilute medicine that the system gets used to it. And so after a period of time, we know that we're going to need to change the strength and potency of the remedy. And so there's a lot of follow up and little kind of fine tuning along the way. And so it's very much a partnership and needing to be fully engaged and very self-aware and of what's happening inside, so that then the practitioner can make a really educated decision as to what the best next step is. So tracking symptoms is very vital, because the homeopath is only as successful as you are in describing and articulating your internal experience, because that's what we're trying to treat is, not just how it looks, but how you feel and how anxiety feels inside, right? So it really requires you to be really in tune and paying close attention. So often patients are surprised at how much they're noticing once they start homeopathic treatment, because we're asking them all these questions and they're like, I would have never thought to pay attention to this. But as you get used to getting treated and following up with your doctor, you'll find out that your whole life shifts in the way that you are aware of what's going on with you.
Right. Which that's the best way to keep our bodies healthy, right? Is
Yes.
Body awareness at all times, journaling, tracking. So all of this is so great. I thank you for all this wonderful information. Where can our audience find you if they want to get in touch with you? Is it through your website, Facebook? I mean, what are the options there for people to reach out to you?
Sure. So I do have a Facebook page, which you can find me on there, as well as my website. On my website, I've got I believe it's a contact us page where you could just simply shoot us an email. And if you have questions, or if you're wanting to, schedule time to talk with me, I offer a free 15-minute consult. So people can, kind of feel me out. I could feel them out, see if it's a good fit. And if not, I have many colleagues that specialize in various areas where I may have a good referral for you. So certainly can reach out that way, as well as my email. I can list that for you as well.
Okay. No, that's fabulous, because I'm sure that as parents are listening, like we talked about, all of our kiddos that are on the spectrum, I mean, they all have different needs, even, our kiddos that have special needs. I mean, all of their needs are different. And so it's very hard to say, well, this is going to work or that. But if they're able to have a little consultation with you and, kind of describe the things that are going on, it'll be so beneficial, so beneficial. So I thank you so much for spending we've almost been together. Well, we were together a little earlier because we had a little technical difficulties, but this 45 minutes with our audience on this Thursday, I so appreciate it. We will drop all of the links below in the information that we spoke about with some of the foods and those types of things. If you want to learn more about any of our other podcasts, YouTube tutorial videos, or any of those things, make sure to head on over to theonairadvocate.com. And as well, remember that our private Facebook community is launching June 1st. So make sure you go over there and request to be a part of it so we can be chatting on a daily basis. Thank you so much, Dr. Grise.
Oh, thank you, Tammy. I really appreciate it. It was great chatting with you this morning.
Thank you. You have a wonderful weekend. Because that's coming up. So it's almost Friday.
It is coming up. We're in triple digits here, so I'll be spending most of the time in the pool. So.
Oh my gosh, in the hundreds. Okay.
Yes. All right. Take care.
Thanks so much, everybody. Have a wonderful Thursday. God bless. Bye-bye.
Bye.